Hello, it's CJ. Has it been 5 weeks since the first day of your last menstrual cycle and you have a positive pregnancy test? Congratulations, you are officially 5 weeks pregnant. Today I'm going to let you know what's happening inside of your uterus, what some of the normal signs and symptoms of pregnancy are at this point, and when you should be concerned. And if you stick around, I will tell you the 8 things that I recommend you do now that you are pregnant. So inside of your uterus, over the past 2 weeks, your fertilized egg has implanted and started building a placenta. He or she is now being referred to as an embryo and is roughly the same size as a sesame seed. Inside that human, this week, the brain, the spinal cord, and the heart are all developing. Your little one is changing hour by hour. At about 5 weeks and 3 days, there should be a detectable heartbeat. A normal heart rate at this point is anywhere from 85 to 100 beats per minute. If you have an ultrasound this week, you will probably see a tiny line. That is what's called the fetal pole. In the middle of that tiny line, you'll see a flicker. That's the baby's heart beating. Next to the baby, you'll see a circular structure that kind of looks a little bit like a Cheerio. That is the yolk sac. That's what's feeding the baby until the placenta is done growing. You have a lot of hormones at this point that are keeping your pregnancy going. Those hormones can have some side effects. You may be really tired. If so, try to sleep whenever you can. You are probably having some breast tenderness. If that's the case, make sure you're wearing a good supported bra and let your partner know that the girls are off limits for now. You may be feeling some nausea with or without vomiting. If that's the case, I recommend small, frequent meals throughout the day. Avoid foods that are greasy and/or spicy. You also may have no symptoms whatsoever, and that too is normal. You may have the occasional cramp, the occasional twinge. You may even have a spot or two of blood, especially if you've had sex. What's not okay? Bright red bleeding that's enough to saturate a pad. Cramping that won't go away, or severe pain of any kind. It is also not okay for you to be unable to keep food or liquid down. If you are struggling with that, please contact your OB provider. So what should you be doing these days? Here are the 8 things that I recommend. Number 1, try to take a prenatal vitamin every day. If the taste or the smell are bothering you, it is okay for you to take an over-the-counter gummy, or you may even want to try taking them at night before you go to bed. Number 2, you want to find your OB provider and schedule that initial visit. Unless you have a reason to be seen earlier, it is very normal for you to not be seen until 8 to 10 weeks, and that's okay. Number 3, check with your family as well as your partner's family to see if there's any history of any of the genetic illnesses, specifically Down syndrome, cystic fibrosis, and spina bifida. Number 4, try to maintain a good healthy diet. Fruits and vegetables, whole grain breads and cereals, lean meat. Foods you want to avoid: deli meat, that's any meat that comes from a deli. Unpasteurized cheeses, those are those soft cheeses that smell like feet. And any raw fish. Number 5, make sure you're staying well hydrated. 10 to 12 glasses of water a day is what is recommended. Basically, you should never be thirsty. Number 6, decrease caffeine intake to no more than 200 milligrams a day. That is the equivalent of 12 ounces or 300 milliliters of coffee. If you are currently smoking, using street drugs, or drinking alcohol, you need to stop doing that. Number 7, try to stay active. Unless your provider has told you otherwise, it is absolutely fine for you to exercise, have sex, go on vacation. As I tell my patients all the time, you're not sick, you're pregnant, live your life. And number 8, write down all of your questions in anticipation for your upcoming OB visit. I can't tell you how often patients get into the exam room and they completely forget what they were going to ask. In the meantime, if there are questions that I can answer for you, I hope you'll leave those in the comment section below. While you're in that comment section, I would also really appreciate it if you'd hit the like button. And if you know somebody who is early pregnant and might benefit from the information in my video, please feel free to share it with them. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.